The thoracic cage is an assemblage of bones which include the ribs, sternum, and thoracic vertebrae. These structures are both bony and cartilaginous, and together make up the central part of the axial skeleton, which is a core structure of the human skeleton. Not only does the thoracic cage support the human body, but it creates a protective shell around some of the body's most vital organs, such as the heart and lungs. The thoracic cage also provides many sites for muscle attachments, such as the internal and external intercostal muscles and pectoralis major and minor. This video will focus on the ribs of the thoracic cage. They span from the top of your shoulders to the bottom of your waist. There are 24 individual ribs, making a total of 12 pairs of ribs in both males and females. This was first mentioned by Flemish anatomist Vesalius in 1543. This discovery was controversial in the 1500s because devout Catholics believed in the biblical story of Adam and Eve. The story was written that Adam removed one of his ribs to create Eve, and therefore all men had one less rib than women. Today, beginning with Vesalius' scientific discovery, it is known and accepted that the male and female body both have 12 pairs of ribs. The 12 pairs of ribs are classified into two groups, the true ribs and the false ribs. These are named depending on their location and whether or not they articulate with the sternum. The first 7 pairs of ribs are considered the true ribs and articulate with the sternum via the costal cartilage. The 8th through the 12th pair are considered the false ribs. However, ribs 8 through 10 are only the false ribs that have indirectly connected to the sternum via the costal cartilage. The 11th and 12th rib are classified as false ribs, but they are also known as floating ribs since they do not have any attachment to the sternum and only articulate with the vertebrae of the spine. These are the ribs which some female celebrities have allegedly removed for cosmetic purposes so they can have a smaller waist. So far, this video has covered the rib cage as a whole unit. So now it's time to look at the parts of the individual rib. The head of the rib is the end closest to the spine. The head of the rib articulates with the superior costal facet of the thoracic vertebrae. Next to the head is the neck of the rib. The neck is a flattened part of the rib that extends laterally from the head. The neck articulates with the transverse process of each vertebrae. Its anterior surface is flat and smooth, but its posterior surface has a roughened surface for the attachment of the costal transverse ligament. The tubercle is a projection on the posterior surface of the rib at the junction between the neck and the shaft of the rib. The tubercle provides an attachment for the ligament and articulates with the transverse process of the vertebrae. The tubercle is much more prominent in the upper ribs than the lower ribs. The angle of the rib is the curvature of the rib, which bends around the rib towards the anterior side of the body. The shaft, or body, of the rib is the largest part of the rib. The shaft runs from the sternal end of the rib to the angle. Each rib's shaft has a smooth superior surface. However, on the inferior surface, there is a sharp, thin groove called the costal groove. This is where the intercostal nerves and vessels are located. The flat end of the rib, also called the sternal end of the rib, is where the rib articulates with the costal cartilage anteriorly. In forensics pathology is the sternal end of the rib, which is used to estimate the age of a person through microscopic examination of bone remodeling and bone deterioration. In a young adult, the rib end walls are thick and smooth with a scalloped around edge. In an older adult, the walls are thin with sharp edges and bony, irregular projections. When a rib is broken or fractured, it can be very painful. A fractured rib can cause an interruption in a person's breathing and sometimes even more serious internal injuries like a punctured lung, which can result in death if not treated. Rib fractures can occur from trauma such as car accidents or sports injuries, but they also happen without direct trauma. Repeated coughing or a very long sustained coughing can cause a rib to fracture. Also, non-contact sports such as rowing or golfing can fracture a person's rib. Even bone diseases such as osteoporosis, cancer, and infections can cause a rib to fracture. The weakest part of the rib is just anterior to its angle. But a rib can be fractured at any location. The most commonly fractured ribs are the middle ribs, particularly the 7th and 10th. The first rib is rarely fractured because it is protected behind the clavicle. A particularly serious and potential life-threatening injury to the ribs is called a flailed chest. A flailed chest is a condition where the broken or detached bones move separately from the rest of the ribs. This causes severe pain when a person inhales and exhales. If not treated, a flailed chest can result in death. Rib fractures can be hard to treat. There is no specific treatment for rib fractures, but applying ice, taking pain medication, and resting are usually recommended by physicians in order to reduce the inflammation and pain. The ribs protect the heart and lungs, two vital organs essential for life. The ribs create a strong supportive structure for movement and bodily functions such as inspiration and expiration. When injured, the ribs inhibit these functions and also limit a person's activities. So it can easily be seen how important the rib cage is.